Sometimes I take the kind of productivity analogy of those big rocks in planning your day. I have so many families that say, how am I supposed to get through all of this, right? How am I supposed to do all of these therapies, keep up with the treatments, all of these appointments? Where am I supposed to get this time from? Especially when I ask things like, are you getting support for yourself, right? It's this question about in which hour on which day do you think that theoretically should happen? And we use that analogy of having a jar and having your biggest rocks be those biggest priorities. If the biggest priority is getting to spend an hour with your child while they're alert and awake, to hold their hand or bring them outside or whatever else it is that would make that day to you and your child feel like the most meaningful thing, let's put that big rock in the jar first. And then let's put the next bigger rocks about the things that are really important for that child's safety, their ability to actually be present and feel comfortable during that big rock time. Those are the next ones. Those are the ones that are going to come in next and that are going to fill up the rest, more of the space. And we're going to keep going down for all those rocks. And maybe therapy is going to end up as a really tiny rock, that's not going to actually get that much space. And that reorients a lot of how families think about their day and their week and their time. And maybe some of their other doctors might disagree with that approach, and that's where I can come in and liaison with some of them to say, tell me what worries you as a doctor about missing out on that therapy, or, is there a frequency with which we could still capture most of the benefit without, the downside of having to do it this frequently or something like this. Sometimes that's not modifiable. Sometimes they really need it as frequently as it's being prescribed. And so then we can talk about it like that. But if we keep sight of the big rock being the meaning, the human connection piece that's central to that jar getting filled up, then sometimes it's just a different way to orient to the task list as compared to the external pressures of what everyone else thinks that they need to be doing.